Why are clot-busting drugs used for stroke? Have you ever wondered why clot-busting drugs are so crucial in treating strokes? Well, let's dive into it. Clot-busting drugs, also known as thrombolytics or fibrinolytics, play a vital role in treating acute ischemic stroke. This type of stroke happens when a blood vessel supplying the brain gets blocked by a clot. When this occurs, brain tissue is deprived of oxygen and nutrients, which can lead to serious damage. The primary goal of these medications is to quickly restore blood flow to the affected area of the brain. They work by converting plasminogen, a protein in the blood, into plasmin. Plasmin is an enzyme that breaks down the fibrin mesh that holds blood clots together. By doing this, the clot is dissolved, and the blocked blood vessel can reopen, allowing blood to flow again. Ischemic strokes account for about 87% of all strokes. Without timely treatment, brain cells can begin to die, leading to long-term neurological deficits or even death. The most commonly used clot-busting drug for this purpose is intravenous alteplase, also known as recombinant tissue plasminogen activator. It is most effective when given within a critical time frame, usually within 4.5 hours of the onset of symptoms. The sooner the drug is administered, the better the chances of improving functional outcomes for the patient. When given promptly, alteplase can significantly reduce the extent of brain damage. The standard dose is 0.9 milligrams per kilogram of body weight, with a maximum dose of 90 milligrams. This is typically administered in 2 parts, a bolus followed by an infusion over an hour. While there are other treatment options, like mechanical thrombectomy, which involves physically removing the clot-busting drugs remains essential, especially when immediate access to thrombectomy is not available. They are considered the standard of care for eligible patients who have acute ischemic stroke and do not have contraindications, such as a high risk of bleeding. It's important to note that the use of these drugs is done under strict medical supervision in emergency settings. This ensures that the benefits of dissolving the clot outweigh the risks, such as potential bleeding complications. In summary, clot-busting drugs are used for stroke because they directly address the underlying issue of blood clots blocking blood flow to the brain. By restoring circulation, they help reduce brain damage and improve outcomes for patients when administered quickly and appropriately. Always consult healthcare professionals for personalized medical advice regarding stroke treatments.